Good morning, and welcome to another edition of United Way for Southeastern Michigan's What's the Word Wednesdays. My name is Courtney Howe, and today we're going to be talking about what parents should know about COVID-19, the flu, and vaccinations for young children. Whether you're a parent of a teenager or a 4-year-old just starting preschool, back to school can be both a joyful and stressful time for families. Between shopping for school supplies, getting up to date on vaccinations, and adjusting schedules, it's a lot for any parent to handle. Today, we're going to spend a half hour talking about the latest information about COVID-19 and vaccines. We'll also be talking about taking your questions live during the town hall. So please put your questions for our guest speaker into the chat box on Zoom or into the comment section if you're watching on Facebook. We are joined today by Dr. Scott Grant, a board-certified pediatrician at the Detroit Medical Center, a Children's Hospital of Michigan, who specializes in ambulatory pediatrics and adolescent medicine. Dr. Grant's focus is caring for his patients, as well as teaching pediatric trainees in academic primary care and hospital pediatrics. He attended medical school at Texas Tech University in El Paso, Texas, before his residency at Phoenix Children's Hospital. After completing his residency, he joined Children's Hospital of Michigan in 2017. Dr. Grant is a husband and father with a new little one on the way. Congratulations.
Thank you.
He is passionate about helping millennial dads with young kids find the joy in fatherhood and become experts in the health of their children. Thank you so much for joining us today, Dr. Grant. We are excited to hear more about your work and uplift our community's questions.
Thank you so much. I'm so pleased to be here. This is such an important topic, and it's such a busy time for parents. As you mentioned, I've got two little ones myself, one who is going to be starting school in the next couple of weeks and another one on the way. So it's a busy time for a lot of parents out there, and I'm hoping that I can help answer some questions and relieve some anxieties.
Absolutely, I know, and our audience is really excited to learn more and be engaged. So I would love to start out by talking about the coronavirus, also known as COVID-19, and the flu. So what are some of the most frequently reported symptoms of the flu and COVID, and what should we look for? And what has really changed over the newer variants?
Sure. There's certainly a lot of overlap. It's certainly very difficult, I would say basically impossible to tell the difference just based on symptoms between the flu and COVID-19 and add in, any number of other viruses that we know are out in the community at various times. And so it can be hard for parents to know, like, what do I do? What is this? How do I respond to this? A lot of those symptoms are pretty common. Some of them are as simple as sort of what looks like a cold, some runny nose, some cough, congestion, those kinds of things. More severe versions of both the flu and COVID-19 can include high fevers, which I know is a thing that stresses a lot of parents out. And so you'll certainly see that. And then in more severe cases, especially with those fevers, sometimes kids won't be eating and drinking as well, which is another thing that brings a lot of stress to parents. So those are probably the most common things. There's some other outliers that come with difficulty with breathing and those kinds of things. Some of the other classic symptoms we don't hear described quite as much in kids for COVID-19, specifically the loss of taste and smell, for example. It can sometimes be hard for kids to describe that, although certainly there's reason to believe that they might still have those symptoms. So mostly it just looks a lot like the flu or other types of colds that they might have.
Wonderful. Thank you so much for that. Some other questions that we're going to, we have that's on cue here. What are some of the most frequently reported symptoms to look out for, especially with the new variants? So are there any major changes? What does that really look like?
Yeah, so my experience with treating kids who have COVID-19, both in the clinic and in the hospital, where I spend some time as well down here at Children's Hospital, is that every variant sort of looks a little bit different. It seems like with these most recent versions of Omicron and the subvariants of Omicron, We tend to see kids who are having more of the fevers. This variant is hitting everybody, and it hit my house a couple of months ago. And I know that was one of the big symptoms that both of my kids had, was they just had really high fevers that would not go away for several days. And that's certainly consistent with what I'm seeing in the hospital. And I'd say that was a little bit more than what we were seeing for kids who are coming in with COVID, say earlier in the pandemic, right? In back in 2020 and those kinds of things. So every variant looks a little bit different. Unfortunately, none of the variants are sort of different enough from all the other respiratory viruses to really distinguish them at home as a parent. Even for me with extra medical training, there's really no way for me to know one way or the other without doing a test. And so that's, we'd like to come up with some way to for parents to be able to just know, like, oh, this is not COVID just based on some symptom subset, but it doesn't quite work that way, unfortunately.
What are some of the best practices to as parents are preparing to have their children enter school? What are some best practices for prevention as they are preparing to go in? So I know some school districts, masks are still mandatory, some are optional. Again, what are some preventive measures as parents should take prior to the first day of school?
Great. Yeah, I think it's stressful for parents who are sending their kids back to school. I think it's important to know your school's policies. I think you laid that out nicely. I think it's important to try to at least keep an eye on, how many cases of COVID and what are the hospitalization rates. One of the things that has happened during the pandemic is a lot of that information is a lot easier to find now for parents than it was at the beginning of the pandemic. So just having that information available to you to be able to make the best decision for your own children. Now, thankfully, we have vaccines that work really well, and we'll talk a little bit more about vaccines, I'm sure, in the next few minutes. But for all kids from 6 months and older, can get some level of protection against COVID-19 specifically, and eventually flu. Flu shots aren't quite out yet for this season, but we can talk about that as well if that's an interest of your audience. Getting vaccinated is going to give kids some amount of protection. Again, it may not prevent the illness itself, but what we know is that getting protection from these vaccines does prevent severe illness. It prevents needing to go in the hospital, and it protects people from death, which is, of course, one of our highest priorities, especially when we're talking about keeping little ones safe. And I think beyond that, parents have to know sort of what's best for their family. So do they have high risk people that live in their home or that their children interact with regularly, that would affect the way that they think about how important, say, wearing a mask while they're at school is, or those kinds of things. And certainly if you're in a place where masks are being required, recommend that. We do know that that is going to also decrease transmission, especially in periods of time that are high transmissibility. But now the CDC tells us that there are certain lower levels where if hospitalization rates, for example, are below a certain level, that the importance of wearing that mask just needs to be balanced out with sort of the educational value of kids needing to like see other people's faces to be able to learn and understand what they're being told at school. It's a very complex thing to try to balance out.
Yeah, I can imagine. I can definitely imagine. So, another question that we have is, what should I do if my kid is exposed in school or in daycare? So, we talked about what we can do to prevent. So, when or if it happens, what are some best practices?
Sure. I would start with just keeping an eye out for symptoms. That's a very important detail. This is true for, we do this for COVID-19 very specifically, but you will probably, excuse me, you will also probably find yourself in a position where your kid gets exposed to flu or any other number of respiratory viruses. And so just keeping an eye on your kid, keeping an eye on what symptoms are they having, how severe are they getting, and are they able to sort of drink enough to stay hydrated. That's something that we worry about quite a lot. And those are kind of the details. And then, especially if you know that it's an exposure specifically to COVID-19, then again, being aware of the most updating testing and that word just left my brain, isolation protocols, both for your school and your school district, but also sort of for our area. And so right now we're mostly seeing a practice of keeping folks isolated for 5 days, and then they can go back and wear a mask for 5 days as long as they're symptom free at that point. But that's rapidly evolving. So at the point that I finish this sentence, that might be out of date. So just being aware of sort of what the most recent protocols are, and then especially as it relates to schools and daycares, following those protocols as well. And then just being careful at home as much as you can. Again, I have two little kids, so I know like when one of them gets sick, it is nearly impossible to keep them away from each other effectively enough to like prevent one from spreading it to the other. But as much as you can, sort of practicing good hand hygiene, not letting them sort of share spoons and forks and straws and those kinds of things where germs might get transmitted. Acknowledging, of course, to all the parents out there that I know exactly how hard that is, but that's a thing that you can try to do just to try to keep that transmissibility a little bit lower.
That's super helpful. And I want to kind of transition this conversation to vaccines. That has
Sure.
been one of the largest topics, especially with vaccinations for children.
Hmm.
So, first question is, are the flu and COVID vaccines safe for my child? And what are the differences between the two different vaccines?
Sure. So, yes, the short answer is yes. Both of those vaccines are safe for children. They've been rigorously tested through all the normal vaccine testing protocols, and they are safe to be used. And at this point, they've been given to thousands and thousands of kids, and we know that they work effectively. Again, primarily at preventing those severe illnesses and hospitalizations and those kinds of things, which is really the most important thing. It's annoying, and I don't want to roll over the fact that like having a kid who's sick at home is not nothing. It's frustrating, and it's heartbreaking as a parent. And so I do want to acknowledge that. But in terms of the really important things that we needed this vaccine to do, it does those things. And so I think that's a really important point to make, especially around the COVID-19 vaccine. Um, they are sort of made differently, the flu vaccine and the COVID-19. All of the COVID-19 vaccines that are available currently are for kids are the newer style mRNA vaccine, which is a newer vaccine technology, although it's been in development for several years. This is just sort of its moment for prime time. And the flu vaccine is sort of a more traditional inactivated viral particles type vaccine. Without getting too much into the weeds, we can talk more about that if that's interesting to your audience. That's sort of a place where people like me nerd out on the details, but essentially they sort of work by slightly different mechanisms, but they're both safe and effective for kids for the type of illness that they're trying to prevent.
Does the children's vaccine differ from the adult dosage? There's been a lot of again, questions about the different vaccines, especially for children. So is there a difference between the adult doses, and also with the boosters, are they required for children as well as they are for adults?
Yeah, absolutely. So the doses for younger kids, um, are lower, and then this new round that have just come out that got approval for the Pfizer, um, or for the vaccines for 6 months to 5 years old is an even lower dose than sort of the childhood dose, which is a lot for those of us who are giving the vaccines to keep track of, to make sure we're getting the right dose to the right kid. But there are sort of slightly lower doses that are needed to get an effective response from those vaccines for school-aged kids, and then for younger kids in that 6 month to 5 year old age range. And the data shows that getting the complete series of whichever vaccine that you're using generates a sufficient response to have the benefits that we've been talking about. And you had a second question, and I forgot what it was. I'm sorry.
No, yeah. So just making sure that that booster, the requirement
The booster.
for children to be boosted. What is the update on that, and what do you foresee about boosters in children?
Yeah, so currently the recommendation is primarily for kids 5 and older. If it's been more than 5 months since the last time your child had a dose of the COVID vaccine, they are eligible for a booster, which for most of them would be a third dose of the vaccine. And so far, that's the only recommendation that's been made. There are some special cases for kids who are immunosuppressed or immunodeficient, who are at even higher risk, that there's some other recommendations for potential additional booster doses. But that's the current recommendation for boosters. I'm not aware of anybody who's requiring boosters, say for admission to school or those kinds of things. But again, really important for parents to be in communication with their school and their school district to kind of know what the recommendations are and what the requirements are for that particular school district.
That's extremely helpful. Thank you so much. And another question that we have is, again, talking about vaccines for children. What are some kind of what are the different side effects that you're seeing in children when it comes to the vaccine specifically?
Mhm.
So kind of talk about that, if any at all.
Absolutely. Yeah. So the side effects that we're seeing to the COVID vaccine are basically the same as the side effects we see from any other type of vaccine that we give. And the way that I talk about this with families is we're sort of giving your child a small piece of whatever it is that we're trying to protect them against, whether that's, chicken pox or COVID-19 or flu or, you know, uh, pneumonia causing bacteria or whatever the case is, whatever we're vaccinating them against, we're giving them a small piece of that so their body will recognize it and make an immune response ahead of time so that if they ever see the real thing, they'll be able to fight that infection off more effectively because they've got a head start. And so, what we want to happen when we give the vaccination is to see some activation of the immune system in response to that immunization. And so, that can look like any other activation of the immune system that you'd see when your kid actually gets sick. And so they might have low grade fevers in response to the immunization, which to me is just a sign that that immune system is raring up. They might be a little bit more tired or fatigued as a response, again, because the flare up of their immune system is sort of taking a little bit out of them. And then you have local reactions at the site of the vaccine. So some kids will describe soreness at the place where the immunization is given. They might get a little bit of redness, which again is just a sign that what's supposed to happen, which is all those white blood cells that are supposed to work on making those antibodies to try to fight off that infection if they ever see the real thing, are coming to that area where the immunization was given, and they're doing what they're supposed to be doing. And so those are mostly what we're seeing in terms of side effects from this vaccine and many other vaccines.
Thank you so much for that. That was extremely helpful. Another question that we have, any recommendations for making testing or vaccinations an easier experience for kids? I know I was one of those children who was mortified of needles, like had to
Yeah.
strap me down. So I know that you all have different best practices on how to
Mhm.
calm children and make them feel more at ease and safe and during those times. But again, how can we, or how can we as parents, how can we as family members make this experience better for them?
Uh, on some level, you can't. There are certain,
Yeah.
there are certain things that you can do, but like at the end of the day, they're gonna get a poke, and that's not the most pleasant thing, and kids don't always appreciate that. I would say, um, distraction is sort of a really key thing. So when I take my kids to the doctor to get their vaccines, I always try to bring along a book or a toy or something like that. And then when we lay them down on the table so they can get their vaccines, they're usually getting their vaccines down in their legs. And I sort of stand up by the head and I sort of put the book as like a blocker so they can't actually see what's happening down below. So I kind of put the book on their belly so that they can see the book and not anything past the book. And I think just not being able to like see what's happening helps. And so it's a little bit of a surprise, but then it's sort of it happens and it's over very quickly for the vaccine specifically. For little babies, having like a bottle of milk or formula on hand for afterwards to help with that soothing sometimes can help as well. Same thing for older kids. I guess you could bring like a sippy cup of milk or something like that to have just to kind of help them soothe. A lot of younger kids will use that as a soothing technique. Um, the testing is harder because it's happening in their face and there's no way to make that less intrusive than it is. Anybody who's had a COVID test knows exactly how brain tickling that can be, and there's not really any way to make that better, unfortunately. Um, I would say what I would recommend, what I did when my kids were getting tested, is just to like hold them. If you can sit them in your lap and sort of hold them and hold their arms down and just sort of give them some reassurance. It's the same thing I do when I take the kids to the dentist, right? It's kind of the similar experience where they're like in the kid's face. And again, so I have younger kids. So if I can just sit and hold them while whoever's doing it, we can get it done faster and it'll be over with. And that's the best thing to get it done. It's just to try to provide that security and that reassurance to your kid that like, it's okay. And I'm here and I wouldn't let them do anything to you that wasn't in your own best interest. But then like, just hold them and let's get it done and be done with it. Right. And then you can do some of the same soothing techniques for after the test as you can for after the vaccines, if that's what you need.
That is wonderful. We have a question from the audience here. Can the flu and COVID vaccines be given at the same time, or should there be a grace period in between the vaccines?
They can be given at the same time, and I usually recommend that approach. One of the things that I talk to the residents about is, the kids aren't counting how many times they're getting poked. They just know that they're being held down and they're getting poked. And so to me, it seems more uh, distressing to the child to like get one poke today and then have to come back in 2 weeks and get another one, and then 2 weeks and get another one. Like they're only counting how many times they're getting held down. They're not counting how many actual pokes are happening every time they're getting held down, if that makes sense. And so we know that medically it's safe to give all of the vaccines together at the same time. There are rules about like how far apart the sites can be. And so we'll put a certain number in one leg and a certain number in another leg. There are practicalities to that. But certainly if your kid's getting 4 or 5, the 12-month visit is particularly bad because there's 5 recommended vaccines at that visit. We can do all of that safely in one visit, and that's usually the way that we recommend it for that reason.
Thank you so much for that. Another question we have in queue is, if my family got COVID last year, can you get it twice? And are there increased risks for reinfection?
Sure. So you definitely can get again, especially with every new variant. That means that something in the virus has changed to make it sort of have a slightly different appearance to the body. And so your pre-existing antibodies will hopefully help you fight off that infection. So each subsequent infection isn't as severe as the one before it, but you certainly can catch it again. We certainly know that there are lots of folks. And unfortunately, again, even if you've been fully vaccinated and boosted, like I said, it hit my house a couple of months ago, and I'm fully immunized and got a booster. I was at the front end of all of that because I work in the hospital, and I still got it myself. So sometimes there's just nothing you can do about that. But again, thankfully, it wasn't severe enough that I had like the difficulty with breathing. I didn't have to go to the hospital or anything like that, and that's really what we're trying to prevent. And so you can get it again, but again, hopefully, if you've had the infection before, that's going to give you some amount of immunity. And then if you add on having COVID before and having immunizations, probably the combination of those two things, there's data that shows that that's probably actually the best case scenario in terms of long-term protection against COVID. And so that's the way to think about that. It's gonna happen. It's sort of here to stay to a certain degree. But there are things that you can do to hopefully make that infection less severe than it might otherwise have been.
Speaking of long term, can children also get like what's been classified as long term COVID?
Sure.
Can you kind of talk about what the long term versus short term looks like?
Sure. And in kids, we kind of think about this across sort of 3 different time spectrums. And I know we're coming close to the end of our time here, so I'll try to do this quickly. So initial like short-term COVID is sort of the classic respiratory infection, like what we've been talking about here today, the fevers, the cough, the runny nose, that kind of thing. Usually lasts for a few days and then it goes away on its own. In more severe cases, there are things that we can do in the hospital. That's sort of the first thing. In kids in particular, we saw actually before we were seeing long COVID, we were seeing what we're calling MIS-C, so multi-system inflammatory syndrome for children, which seems to happen about 4 to 8 weeks after an initial COVID infection, although all of this is still emerging data. And kids get this like huge inflammatory surge in their body. They can get GI symptoms. They can have a rash. They get high fevers. And so it's a sort of slightly different type of response. It's not sort of a direct infection, but it's an inflammatory consequence of the COVID-19 virus, if you will. And then the third subset is this idea of long COVID. And the answer to your question, can kids get long COVID, is certainly yes. We're seeing kids who have sort of persistent symptoms that are being attributed back to having had an initial COVID-19 experience. It's really, because we're still early in the long COVID game, it's hard to really describe like what exactly to look for, but some of these kids and adults too are describing sort of prolonged episodes of fatigue or inability to get back to their like previous activity levels. That's a really big one. So people who were previously like very active runners, like just don't have the stamina that they had before they had the infection, are really struggling to kind of get back to that level of activity, for example. Um, there are others who report that their sense of like taste and smell that went away when they got the initial infection takes a very long time to come back. And then there are others who are reporting after the COVID vaccine, not the vaccine, excuse me, after the COVID infection, that they're developing other new symptoms that seem to maybe be at least temporarily associated with that initial COVID infection. So we're still trying to figure all of this out. This is an area of active, ongoing research, and so this is another thing that will be different by the time I finish this sentence. But it's certainly something to pay attention to, and to know that if your child had a COVID infection and they are having some persistent types of symptoms, to keep in touch with your primary care doctor. That's going to be the punchline that I leave you with, here at the end, is sort of keep in touch with your primary care doctor. And if you haven't found one, find a primary care doctor that you like and you trust, and you can have these conversations with. I can only talk about so much in the 25 minutes that we've gotten to spend together this morning. But if there's folks out there who still have questions, who still want to ask a few more additional questions about the vaccines or about long COVID or about any back to school. We didn't even get to talk about routine childhood immunizations. I'm happy to talk about that for these last few minutes as well. But all of those conversations can also happen in the context of a relationship with a primary care pediatrician. And that's what I'd strongly recommend folks pursue.
Thank you so much. We have one more question. I know you wanted to do another closing remark about immunizations, but I heard there's a new vaccine coming out that is better against new variants. Should I wait to get my kids vaccinated if they are not already vaccinated?
Great question. There is a new vaccine that they're working on getting approval for. Currently, the approval that they're seeking, just like we saw with the first round of immunizations, is all adults. It's all 18 and older. And as we've seen, there's sometimes delays with the process to get it approved for kids. So my personal recommendation would be not to wait, especially if you have a kid who's starting school and you want to try to have them protected by the time they're starting school, or fairly quickly after they start school. I would be inclined to get your kid initially immunized with one of the established COVID vaccines that's been approved for kids. And then hopefully somewhere down the road that vaccine will be available and can be used maybe as a booster dose or something like that if it's still needed at the point that happens. But I'm not aware of the timeline for when that might get approved for kids. And you could be talking about waiting months or even a year, as we've seen from some of these other vaccine processes that have played out.
Well, Dr. Grant, that's all the time we have today for questions, but I really, really want to thank you for sharing your expertise and insight with us as we prepare for back to school season. So again, thank you so much for joining us.
Thank you very much. It's my pleasure to be here with you.
All righty. We have a few more updates to share with you before we close out today's events. As a reminder, for everyone in our community who may be experiencing a need, our 211 helpline remains available 24 hours a day, 7 days a week. This includes resources like cooling centers, many of which are open this week. We'll drop a link to find your nearest cooling center. We always maintain a running list of available services in the community and connect you to the support you need. You can also look up resources in your area by using our 211 resource database at unitedwaysem.org/211. We encourage everyone who cares about education and supporting students to consider looking for volunteer opportunities this fall. United Way's volunteer portal has many in-person, remote, and virtual opportunities, including building support kits for students, backpack drives, mentoring and tutoring, and more. You can find all of these opportunities by visiting unitedwaysem.org/volunteer. We'll also put that link in the chat for you. The 2022 Run United Virtual Marathon starts September 14th, and there is still time for you to join. Participants log 26.2 miles over the course of a month and earn chances to win great prizes like Pistons tickets, all while raising funds to support students this fall. To learn more and sign up and to register, please visit unitedwaysem.org/rununited2022. We will return on September 7th with a Labor Day town hall with Shannon Garrett from the Michigan Women's Commission, who will share information about FAIR, Fostering Access, Rights, and Equity for Women Workers in Michigan. You can visit unitedwaysem.org/virtual town halls to stay updated on our upcoming topics and watch replays of previous town halls. That website is also included in the chat box. Again, to everyone, thank you so much for joining us. We will see you soon. Stay safe and continue to live united.